Hello and welcome to TILLY, the Interactive Lupus Link for you, an episodic series presented to you by the Lupus Foundation of New England. I'm your host, Marisa Zeppieri, and I'm so excited to have you here today. In this episode, we are going to be looking at dermatology, skin manifestations, and research that involves lupus. And I'm really excited to introduce you to an amazing woman that I had the pleasure of meeting with a few years ago. Dr. Jillian Richmond. She is an assistant professor and a lupus researcher at UMASS Med School, and she specializes in skin manifestations of lupus. Jillian, thank you so much for being here with us.
Thank you so much for having me, Marissa. It's a pleasure to be here.
Yeah, I get to see you again, this time over Zoom. So, you are an assistant professor and a researcher, but I'm going to just hand this over to you really quick. If you can give our viewers a little bit about your educational background, how you sort of got into the world of lupus, and what you do at UMass.
Of course. So I did my undergraduate training at Johns Hopkins, where I got a degree in molecular and cellular biology. I went on to graduate school at Boston University School of Medicine, where I got a PhD in immunology and pathology. And then I did two different postdoctoral fellowships. The first one was mostly studying chemokines, which are a type of protein that tells your cells in your body where to go. And then I went to UMass to perform a second postdoctoral fellowship with my mentor, John Harris, and we studied vitiligo, which is a different autoimmune skin disease. But we found that the same proteins that are upregulated in vitiligo are also upregulated in cutaneous lupus. So we kind of transitioned to that field, and now I run my own laboratory focusing on cutaneous lupus.
That's amazing. I know that you do so much, and later on I want to actually get into some of the grants that you've recently received and what you're doing there in the areas of research, because I think for those of us that live with lupus, we're not really sure what's going on too deep in the research world. So sometimes we wonder, you know, are there new things coming down the pipeline? Are there new medications? Are there new things that people are finding that maybe we just weren't aware of 5 or 10 years ago? So we're definitely going to get into all of that. But I want to sort of back up first before we dive into that area. And I just wanted to talk to you a little bit about just the different types of skin manifestations that can happen with lupus, how they differ, and how they might manifest. I think one of the largest struggles that I hear from those that are living with lupus and deal with skin issues is they may all sort of seem similar, so we're not really sure if it's lupus or what's going on, or if it's something besides lupus. So can we start there?
Sure. So I will put the caveat that I'm not a physician. I am a researcher. So my I guess perspective of the field is based off of that. But what I do know is that there are 3 major subtypes of cutaneous lupus. We classify them as acute cutaneous lupus, which is usually associated with a systemic lupus flare. There's subacute cutaneous lupus, which is usually associated with sun exposure. And then there's chronic cutaneous lupus, which is usually skin limited. It can involve hair loss and scarring, especially in the most common clinical subtype of chronic cutaneous lupus, which is discoid cutaneous lupus, or DLE. So from a research perspective, we know that they're very, very different in terms of their distribution on the body, whether or not the hair loss is scarring, as in the case of subacute cutaneous lupus, that it's mostly sun-induced. So there are definitely differences in the clinical characteristics of the different types of lupus rashes. But the interesting thing is that when we take a biopsy of your skin to actually diagnose your lupus, we look at it under a microscope and they look very, very similar. All of the different subtypes of lupus have something that we call interface dermatitis. So it basically means that a bunch of white blood cells are crawling in between the different layers of your skin. So we're trying to understand why they look so similar on a microscope, but they look so different clinically.
That's interesting. And I remember you were talking to me about some research that deals with the white blood cells that I definitely want to get into later. So as we move into that area, if you could tell our viewers what goes on at your lab at UMass Medical School. What are you currently researching, and what are you and your team working on?
Those are great questions. So my lab does a combination of different approaches. We like to do translational research, meaning that we try to understand the disease process using different models. And then we try to confirm that what we think is happening is actually at least present in human tissue. And that's where the skin biopsies come in. So we have a technician and several students right now who are helping to study the different aspects of lupus. Right now, because of the pandemic, we're actually all working remotely. So most of my trainees are now doing gene expression analysis or flow cytometry data analysis. So flow cytometry is a special type of assay we do where we can actually see the cells, essentially on a computer screen. We run them through the machine. They have a specific size and what we call light scatter profile. So we can kind of take a picture of the cells and then kind of study what they're doing. So we do have some data amassed from those types of assays, and the students are all helping to look at that. And the main goal of our research is to understand, as I mentioned, how the white blood cells move around in your body. So the analogy that I usually give to people to try to help them understand the science is if I were to blindfold you, put you in a room, and I would squirt a bottle of perfume, and I said, how do you find where the bottle of perfume is? You would say that you sniff it out with your nose, right? So in this case, the perfume is like the chemokine, and your nose is like the chemokine receptor that helps you find where to go. So the white blood cells kind of sniff out where they want to go in the skin. And if we can block that process, we might be able to prevent a rash or treat a rash. And that's kind of the goal of our research right now.
So that research, I'm assuming, is tied to the 2 grants that you recently received. Can you tell us about those grants, and then how you're focusing on that infiltration of the white blood cells? And really what I want to explore there is so that people understand long term with what you're finding, how this is going to trickle down and help the patients.
Yeah, those are great points. So right now, I actually received 2 grants to study the chemokines. So right now we're funded by the Dermatology Foundation and the Lupus Research Alliance. And those grants are covering CXCR3 mediated migration. So CXCR3 is like a type of nose that a white blood cell can have. And we know that the proteins that attract cells that have CXCR3 are highly upregulated in lupus skin. So that's one of the aspects that we've been covering. We also were very recently awarded a grant from the Department of Defense through the CDMRP, the Congressionally Directed Medical Research Program, for their lupus focus area to look at resident memory T cells. So those are a special type of white blood cell that lives in the skin. It's very long-lived. And it's beneficial in the case of infections like viruses and things like that. Your memory cells can help fight those infections as soon as you're re-exposed. But in the case of autoimmunity, it's actually a negative thing because they're remembering their immune response against your body's tissue. So we think that if we can wipe out some of that autoimmune memory, that we could develop treatments that are much longer lasting for patients.
Wow, there's so much incredible research going on. Thank goodness for people like you, because it's way beyond my expertise, but it's so exciting to hear that there are people, people like you that are working for people like me that are living with lupus. So I have to ask, how did you, or when did you decide, like, lupus is the area that you want to focus in? Was there someone in your life that you knew that had lupus, or something that happened, during school?
So while I was in graduate school, one of my close friends, and she was a senior student, she was my mentor. We actually paired off senior students with incoming students to try to help the new students learn the ropes. So my friend's mother had really severe systemic lupus. She actually had CNS involvement as well. And so her daughter, who, as I mentioned, was in the same program as me, was very, very devoted to lupus research, and, because of her mom, and just seeing how much it affected my friend and her mother, it was really intense. And I've always been interested in autoimmunity from a scientific standpoint, like why does your immune system decide to target your body, right? It's fascinating and weird, and obviously makes some people very, very sick. So to be able to help people like my friend and her family, and also work on something that I find is really interesting, I think was great. And as I mentioned, some of it was just because I had already been working on that chemokine family, and we knew it was up in lupus. So we decided to kind of use the tools that we had developed to study other autoimmune diseases and apply them all to lupus. So then we have like this expertise that we're able to bring in as well.
I love that. Thank you for sharing that. So something that you and I talked about that I definitely want to bring up here. When I asked you, so people that are dealing with skin involvement and sort of going through this journey of seeing their dermatologist and trying to get treatment and whatnot, you were telling me about looking into some of the larger schools, research hospitals. You know, they may not necessarily be in their area, but that there are some of these larger institutions that are doing this research, that are specializing in lupus, and that there are multiple like clinical trials going on. And I think sometimes we sort of get lost in, you know, is there a clinical trial for me, or what happens during a clinical trial, or why is this important, and what would be expected of me, or what am I giving, and how is this going to help people down the road? So if you can talk a little bit about clinical trials to wrap up, I think that that's an area of interest to a lot of people that are living with lupus.
Of course, and that's a great question. So the clinical trials to date have had some difficulties in terms of good controls, because physicians, rheumatologists, they don't want to take their patients off of medication. So we don't really have a placebo control arm for our controlled clinical trials. And that's made it very, very difficult, but also it's understandable. You wouldn't want to take someone off of their meds that are controlling their flare. So moving forward in the field, I think that's one of the challenges, is to try to parse out positive effects of new drugs compared to standard of care treatments. And then in terms of participating in these clinical trials, as you mentioned, Marisa, there are lots of the academic medical centers will run clinical trials. So if there's a way that your physician can connect you with a larger medical center that may have those resources available, that would be one way to get involved in a clinical trial. I will mention that you may not always benefit from the drug. So what you're doing by participating in a clinical trial is really paying it forward to try to help find a drug that can work in the future or help new patients and that kind of thing.
Okay. Well, that makes sense. Thank you for explaining that a little bit more. And I want to give everyone here that's watching an opportunity. So I know that you tweet a lot, and if someone wants to follow you or learn more about the lab at UMASS Medical School, can you just tell everyone your handles, your social media, or if there's a website that they can learn more?
Of course. So we have the UMass Lupus website, which is www.umassmed.edu/lupus. We run a blog there. We also have a Twitter account, as you mentioned, and that's at UMass Lupus. And then my personal academic Twitter account, which has more of the science-heavy stuff, is at T-Cell Tracker.
Yes, she's amazing to follow. I get a lot of great information off of your Twitter, and I love when you share stuff. So thank you so much. I'm really excited. I am so grateful that you were here with us today and for all of this information. And I just want to thank you again, and I hope that we can have you on another episode of TILLY in the future.
Sounds great. Thank you so much, Marisa.
Next up, we have a special segment here of this TILLY episode on dermatology. Dr. Jillian Richmond will be asking Dr. Mehdi Rashigi some of the most common questions that viewers sent in either from Lupus Chick or the Lupus Foundation of New England. Stay tuned.
Hi, I'm pleased to have Dr. Mehdi Rashigi, the director of the Connective Tissue Disorder Clinic and a dermatologist at the University of Massachusetts Medical School in Worcester, Massachusetts. He's here to answer some of your common questions about going to a dermatology visit for your lupus rash. So the first question we have is, tell us about you and your experience with dermatological manifestations of lupus.
So first of all, I'm really glad to be here and have this opportunity to talk to patients. One thing that patient with lupus needs to keep that in mind is that lupus in general as a disease is a very complex and heterogeneous disease. And even when we talk about skin lupus, there are many different subtypes of skin lupus. Some of them are more common and some of them are less common. Most patients, when we talk about skin lupus, that might remind them of the malar rash or butterfly rash of lupus that patients are getting anytime that they have UV exposure. But there are many different subtypes of lupus that they might have some similar overlapping features, but also they might be very different.
Nice, thank you. The next question we have, how would someone know the rash or skin issue they are dealing with could be lupus? Are there specific symptoms to look for? Like, how would they know it's time to see a dermatologist?
So as a general rule, if the patient has a confirmed diagnosis of lupus, I think anytime that they have a new rash or a flare-up of recurrence of a rash, they need definitely uh, ask to be referred to a dermatologist to be evaluated. You can imagine that patients with lupus, similar to patients with no history of lupus, they might also develop other more common rashes, including eczema or allergic contact dermatitis or psoriasis. And sometimes even for experienced dermatologists, it might not be easy without doing the skin biopsy to distinguish those rashes. So the expectation is not of the patients to know if the rash is related to lupus or not. Especially if the patient does not have a confirmed diagnosis of systemic lupus or skin lupus, or they have never had a skin biopsy to confirm that. Typically when we see the patient, even if clinically the rash is very suggestive of being skin lupus, we do a skin biopsy to confirm it. But if we know a patient from before and the patient has a confirmed diagnosis, sometimes clinically we might be able to determine whether the rash is truly a flare-up of skin lupus or not.
Awesome, thank you. Next question. What is the appointment like? Do you biopsy all rashes, or are you able to tell from clinical examination what type of lupus involvement it is?
So again, depending of the patient history, if this is the first time that the patient has this rash, or the patient does not have a confirmed diagnosis of skin lupus, typically we need to do a skin biopsy as a baseline to confirm the diagnosis. In terms of like what are the distinguishing features in a rash of lupus compared to other more common skin rashes, one of the main features most patients, they know that a rash of lupus can be recur or flare up with sun exposure. Some of the subtypes of skin lupus, the distribution is very characteristic. So we were talking about different subtypes of skin lupus. One of them is what we call acute skin lupus, and that's typically the butterfly rash or malar rash on the face. That's typically easy for most patients. If they have confirmed diagnosis of systemic lupus and patient comes and say, you know what, I had a really bad sun exposure within the past few days and all of a sudden started developing this rash, that's typically something that you don't really need to do a biopsy to confirm it. But there are other subtypes of lupus. Most of them also, if they are not acute lupus, if they are like other subtypes like subacute or chronic, they tend to be more pronounced on chronically sun-exposed areas, including head and neck area, upper chest, upper back, maybe shoulders, and outer parts of arms and forearms. So those are some of the clues, but again, if the patient has never had any skin biopsy to confirm that, typically we need to do the skin biopsy.
Great, thank you. All right, the next question is, what is the treatment typically like and how successful are the treatments?
So after so many years, still the gold standard and mainstay of treatment of skin lupus is anti-malarial. Most people are nowadays familiar with some of those medications, hydroxychloroquine, chloroquine, and so these are the medications that after so many years, despite not knowing the exact mechanism, they tend to be the first step and mainstay of treatment for patients with skin lupus. And if the patient do not optimally respond to anti-malarial, then typically the next step would be to add a second agent. And there are other immunosuppressive medications that we can add. If the patient does not respond optimally to oral treatment only, sometimes we need to even consider injections or IV infusions, more immunosuppressive treatment. But overall, if the patient is compliant with the treatment and if they are careful in terms of protecting their skin from sun, the other thing that the patient can easily do is that many patients with lupus, including skin lupus, they tend to flare up with smoking, and anti-malarial treatments tend to be less effective with smoking. So, but if the patient is compliant with treatment and they're very careful with UV exposure and sun exposure, and they try to cut down or stop smoking, there is a good chance that the patient is going to have a really good response. There might be times, especially during the summertime, that you have more sun exposure that the patient might flare up. But for the most part, I think the patient can be reasonably well controlled with those medications.
Great, thank you. We get a lot of questions about lupus skin involvement in the scalp and people losing their hair. Can you tell our viewers more about this? What is causing it? What are the treatments like? And will their hair ever grow back?
So again, going back to the first question, that lupus is a very heterogeneous disease and can present with different manifestations. In patients with systemic lupus, sometimes they might experience diffuse non-patchy hair loss. That hair loss tends to be non-scarring, meaning that when you treat the patient and the disease is under better control, they tend to regrow hair. But there is a subtype of chronic skin lupus called discoid lupus that unfortunately tends to involve head and neck area, including scalp. And that subtype of lupus, if you do not start treatment early on and aggressively, it might leave a permanent scar. And you can imagine if discoid lupus happens on your scalp and you don't treat it soon enough, if it leaves a scar, the hair loss is going to be permanent and there is no treatment to essentially reverse the hair loss that the patient has developed. So the treatment is kind of similar to other subtypes of skin lupus. So the mainstay is anti-malarial, but you might need to add second agents to better control the disease. But sometimes if you feel that the discoid lupus is very active and there is a risk of patient developing a scar because systemic medication might take a few weeks to fully kick in. So we might consider doing intralesional steroid injection to immediately calm down the inflammation on the scalp and prevent permanent hair loss.
Great, thank you. And we know you're recovering from COVID-19, so very glad that you're healthy again. Would you care to share a little bit about your experience with our viewers?
No, not at all. First of all, I think it's important after having this experience to know that the best way is just to, if you can, to avoid getting the infection, at least until we have better treatments, or hopefully at some point we are gonna develop vaccines. But for me, as someone who does not have any prior history of any heart or lung disease, still it was a tough experience. So for a few weeks, I had really high fever and feeling like really fatigued. I had some drop in my blood oxygen level, but fortunately not to the point that I had to go to hospital to have supplemental oxygen or to be intubated. But it's important, especially if you have a prior history of heart disease or lung disease, if you have COPD, if you have asthma. So it's important to be very careful not to get the infection at first place. The other thing is that most of you have heard in the media in terms of, oh, maybe like some of these anti-malarial treatments that we commonly use for lupus, they might be essentially effective in prevention or treatment of COVID infection. And we don't really have the solid data yet, but most people feel that they are not similar to other like immunosuppressive treatment. At least it doesn't seem that they can increase the risk of getting infection or more serious infection. The same with another common medication that we use in patients with lupus called methotrexate. So it does not appear that these medications are similar to other more strongly immunosuppressive treatment. And we can kind of be reassured that when we treat our patient with lupus, we are not truly increasing the risk of getting infection with coronavirus.
Awesome. Thank you. And I want to thank you and the Lupus Foundation of New England for inviting me to participate in this TILLY program.
Well, you were top of our list, so I'm just so thankful that you were able to make it. And everyone watching, definitely follow Jillian. She's incredible. She has so much knowledge. And we just thank you for doing research for people like us and just taking an interest in what's happening in our body and how we can feel better. So thank you for staying tuned and watching this episode of TILLY, and we look forward to seeing you next week. Take care.